When people discuss herbs and natural health products, attention is often directed toward what a herb does. Questions frequently focus on benefits, traditional uses, or potential applications. While these are important considerations, another factor deserves equal attention. That factor is dosage. In this discussion, attention will be given to why dosage matters in herbal medicine, why more is not always better, and why understanding quantity is often just as important as understanding the herb itself. Let us begin with a simple observation. Many substances can have different effects depending on the amount used. This principle is not unique to herbal medicine. It applies across many areas of health and physiology. Water is essential for life, yet excessive amounts can create problems. Exercise supports health, yet excessive training can create strain. The same principle often applies to herbs. This is where context becomes important. People sometimes assume that because a substance is natural, larger amounts must produce larger benefits. At first glance, this may seem reasonable. However, biological systems rarely operate in such a simple way. The body responds to dose as well as substance. What begins to emerge is a more nuanced understanding of herbal support. The question is not simply what herb is being used. The question also becomes how much is being used. This distinction carries considerable importance. Now consider another factor. Herbs contain biologically active compounds. These compounds interact with the body in different ways. The concentration of these compounds may vary between products. Different preparations may contain different amounts of active constituents. As a result, two products containing the same herb may not necessarily provide the same exposure. This is often overlooked. People may focus on the herb's name while paying less attention to quantity, concentration, or preparation. Yet these factors may influence outcomes significantly. It is worth pausing here. One of the recurring themes within naturopathy is individual variation. The same principle applies to dosage. Age may influence requirements. Body size may influence requirements. Health conditions may influence requirements. Medication use may influence requirements. For this reason, dosage is rarely a one-size-fits-all concept. This helps explain why personalized approaches are often discussed within natural health traditions. Now consider expectations. Many people assume that if a small amount is helpful, a larger amount must be even better. In reality, there is often a range within which a substance is intended to be used. Below that range, meaningful effects may be less likely. Above that range, unwanted effects may become more likely. A different pattern begins to appear. Balance becomes more important than excess. This principle appears repeatedly throughout physiology. What matters here is that effectiveness and safety are not separate conversations. They are often connected. Dosage sits at the intersection of both. Too little may be ineffective. Too much may increase risk. Appropriate dosage aims to support the intended outcome while maintaining safety. This holds more significance than it may initially appear. Many discussions about supplements and herbs focus heavily on benefits. Far fewer discussions focus on dosage. Yet dosage is one of the factors that helps determine whether those benefits can be pursued responsibly. Now, this does not mean people need to become experts in herbal medicine overnight. The purpose of this discussion is understanding. Understanding creates a stronger foundation for future decisions. When concepts are understood first, products become easier to evaluate later. This helps explain why education remains important. A herb is not simply a name on a label. It exists within a broader context that includes preparation, concentration, intended use, and dosage. Taken together, these factors influence how a product may be understood and used. This brings us back to the central idea. Herbal medicine is not only about selecting the right herb. It is also about understanding how that herb is used. Dosage plays an important role in that process. Understanding this creates a calmer, safer, and more realistic perspective on natural health support. Future discussions will continue exploring herbal medicine, supplement quality, and the principles that help create informed decisions.